When we first spoke, we talked about how, healthcare is dealing with the forces of standardization in an age of personalization, moving from volume to value, with an industry going through so much change and transformation. How in the world do you create a culture to support that level of change?
We've been practicing value-based care even before that term was coined. We have never awarded our employed physicians for doing more. We've always awarded them for doing the right thing. And we view our job in contemporary healthcare not unidimensional, but we think that each person in the organization has four main responsibilities, and we are an organization as well. One is the responsibility to our patients, so that's patient care. The other is responsibility to our fellow caregivers. The third is responsibility that we have for our organization and our resources. We are a nonprofit. And the fourth is the responsibility that we have for our communities we serve. And the really important thing about those four aspects of care that one does not have an opportunity to opt out of any of those four because they are interdependent. The other distinguishing feature from the cultural standpoint is that we call each one of our 66,000 employees, that's the number of people that Cleveland Clinic employs, caregiver. So if you were to walk down our hallways and you go from one office to another and you take a look at the names of the offices, there are no titles associated with it. So you wouldn't be able to tell what does a person do in the organization. We like to say that we distinguish the value of the person based on their character and based on their impact rather than their title.
For organizations that are still challenged by making this move from volume to value, Tom, what's the first step? How do you start building that culture?
I think the first step is to define what really matters. For us, our ethical framework is very simple. We always say, you have to take care of your patients or your fellow caregivers as your family, and this place is your home. And all these complex business approaches turns out to be very, very simple because that simple framework is applicable. My job is to provide a strategic direction, to to amplify what's our ethical framework and the way that we make a decision, and then to provide an empowerment for teams to solve this, to create a solution. We view healthcare as a team sport or an orchestra, if you will. And while individual capabilities are really important, they shine at the best when they're complementary with many individual characteristics of people around them.
Yeah.
We put a lot of effort on the teamwork. And people do not lose the individuality by being the members of a great team, but they actually augment their ability to make an impact.
Tom, I can't thank you enough.
You're
Thank you so
welcome.
much
Thank
for your
you.
time. Excellent.
Thank you very much.